Separation anxiety disorder. Separation anxiety disorder is a condition in which an individual becomes fearful, nervous, and experiences excessive anxiety when away from home or separated from a loved one or from people to whom the individual has a strong emotional attachment. Separation anxiety disorder causes a child or adolescent extreme distress when she is separated from her parents or caregivers. Separation anxiety is a natural part of the developmental process. It gradually subsides, usually by the time the child is 3 years old. When this fear occurs in a child above the age of 6 years, it is excessive and lasts longer than 4 weeks. The child may have separation anxiety disorder. Approximately 4 to 5% of children and adolescents suffer from separation anxiety disorder. Boys and girls are equally affected by separation anxiety. The fear of separation causes great distress to the child and may interfere with the child's normal activities. Many children and teens with separation anxiety disorder may seem depressed, withdrawn, or have difficulty concentrating on work or play. He or she can become isolated from peers and have difficulty developing and maintaining friendships. School attendance and performance can drop. Children also commonly experience physical symptoms such as headaches, stomach aches, nausea and vomiting at the thought of being separated. Adults with this disorder may be uncomfortable while traveling alone, experience nightmares about separating from folks and loved ones. Some people become severely homesick when separated from attachment figures, regardless of their age. The disturbance causes significant negative effects on social and emotional functioning, family life, and physical health of the affected individual. Risk factors for separation anxiety disorder. Separation anxiety disorder is more likely to occur in children with a family history of anxiety, low socioeconomic status, overprotective parents or overattachment to parents, a lack of appropriate parental interaction. Separation anxiety disorder can also occur after a stressful life event such as moving to a new home or school, stressful situations like death or divorce in the family, including a pet, or some sort of disaster that separates an individual from loved ones for a period of time. Symptoms of separation anxiety disorder occur when a child is separated from parents or caregivers. Some of the most common behaviors include excessive anxiety concerning separation from home or from those to whom the individual is attached, severe crying, clinging to parents, refusal to do things that require separation, physical illness such as headaches, stomach aches, or vomiting, repeated temper tantrums, refusal to go to school or elsewhere because of fear of separation, refusal to sleep without the caregiver being nearby or to sleep away from home, excessive fear of being alone, nightmares about being separated, cannot be alone in a room, bedwetting, avoids participating in new activities. For separation anxiety disorder to be considered, these symptoms must be present for at least 4 weeks in children and adolescents and 6 months or more in adults. Additionally, these symptoms must interfere with social, academic, occupational, or other areas of functioning. Diagnosis. The professional will collect information from home, school, and at least one clinical visit in order to make a diagnosis. If symptoms are present, the doctor will begin an evaluation by performing a complete medical history and physical exam. There are no laboratory tests to diagnose separation anxiety disorder. Doctor may suggest various blood tests to rule out if the symptoms are of any physical illness. Children that experience 3 or more of the above symptoms may be diagnosed with separation anxiety disorder. To meet the criteria for separation anxiety disorder, the child must have the symptoms for at least 4 weeks. Treatment. Most mild cases of separation anxiety disorder do not need medical treatment. The goals of treatment include reducing anxiety, developing a sense of security in the child and the caregivers, and educating the child and family about the disorder. Therapy and medication. There are a number of commonly used treatments for separation anxiety disorder. The most effective and primary type of treatment is cognitive behavior therapy. Cognitive behavior therapy helps children learn several major skills such as how to recognize anxious feelings regarding separation and also helps to develop a plan to cope adaptively with the situation. Exposure therapy reduces feelings of anxiety through practices of exposure to anxiety-inducing situations. Talk therapy provides a safe place for the child to express his or her feelings. Relaxation techniques such as deep breathing can help the child learn to relax more easily. Family therapy also may help teach the family about the disorder and help family members better support the child during periods of anxiety. Children who have more difficulty in identifying their thoughts, a form of play therapy may be used. Play therapy uses toys, puppets, games, and art materials for expression of feelings. Some doctors also recommend contingency management, which is a way to reinforce positive behavior by rewarding children for meeting their treatment goals. Parent-child interaction therapy focuses on improving the quality of the parent-child relationship. These help strengthen a child's feeling of safety, educates parents about situations that cause anxious feelings, teaches parents to communicate clearly with their child. Counseling for the family involves educating the individual and the family members so that they are knowledgeable about the disorder as well as can help the child learn coping skills. Medications may be used to treat severe cases of separation anxiety disorder. It should be used only in conjunction with other therapy. A variety of medications have been shown to be effective in treating separation anxiety disorder. Antidepressant or other anti-anxiety medications may be used to treat severe cases of separation anxiety disorder. Thank you.